And because I'm focusing on my blood flow technique, I'm going to use a cone. You're right. So a cone has the least surface area. So this is probably the most aggressive attachment. And because I'm working on blood flow, do I want to be on that tissue forever? Well, I do, but not forever, especially because I have a small attachment, okay? So if I was working on a patient, maybe I might start with a dampener, which would be a good warm up for the tissue, but we're gonna get right into that local blood flow technique. I'll show you how to do that. Chad, go ahead and we're gonna get you lying prone for us. And if you could take your shoe off on one side, that would be great. Now, if I have a tendinopathy, especially working distally, I want to be able to work over that tissue. So because I have an aggressive attachment and I want to be on that tissue relatively long, I'm thinking 60 to 90 seconds to maximize blood flow, I'm going to go with a low frequency. So my frequency is going to be 1750. Watch how I hold the device. Again, so this way I can be laser precise. So I actually will start with the leg bent, and I am not going to be ergonomically correct, so forgive me on that because I want you to see what I'm doing. But I'm going to start in the muscle tendon junction. I am going to be floating, and I'm going to move in a circular direction. So I like the knee bent. That'll take tension out of the calf. That way I can line the tissue up a little bit with my hand. And I would simply work over the distal Achilles, working proximal and distal right along that muscle tendon junction. And then I would continue to work down. Now notice I'm avoiding bone. I don't want to be bouncing. I'm going to stay on that soft tissue, just like so. And because of my grip in my body position, I can be laser precise with what I'm doing. Now, if somebody had a joint restriction, this would be another fair technique. So watch, if I was to work on the front of the ankle, think about those people who have joint restrictions, as we mentioned earlier, I'm gonna use my dampener. And because the knee is bent, it takes tension out of the calf. And I'm gonna simply work over that anterior capsule. Super soft dampener is a great attachment here. Because I'm near bone, I'm near nerves, I wanna use a softer attachment. So that would be fair game to warm up that ankle joint. In addition, I could work on my active motion technique. So I could find a trigger point and I could be on that trigger point and I would add a little more pressure. So I'm probably like a 3 out of 5 with my pressure here. And then I could have Jenna pull her toes towards her shin. Yep. And then have her point her toe. So I could stay on that trigger point. I'd have her do that 3 to 5 times. And I'd really facilitate, especially through that big toe, as I'm dorsiflexing here, really getting that big toe involved. Then I could actually move with her. So what she's gonna do is she's gonna plantar flex and I'm gonna move actually against her here. So go ahead and dorsiflex. So I'm moving against her and then plantar flex. And again, I would do this 3 to 5 times. Now this is gonna be more for the fascial glide. So again, my pressure is not deep here. And then I could actually move with her. I could choose one band of tissue. I could choose another band of tissue, but again, I would be 3 to 5 repetitions. So there we had it. That was our local blood flow technique for the distal Achilles to work maybe if that person had a tendinopathy or maybe they had plantar fascia. We used a smaller attachment, so I'm going cone or thumb with that. And then we showed you how to improve ankle joint mobility and overall ankle mobility through the soft tissue using our active motion technique.